The patient has a full bladder and we do an abdominal scan, and with that scan we can see the uterine cavity is tracked by the presence of the air bubbles, and air is echogenic. So that is not a photograph of your embryo. That's Patients want to know, when we put the embryo back in the uterus, how can we be sure we're putting it in the right position? And I completely understand, because after all, it's a blind procedure. What does a blind procedure mean? There is a uterus, there is a catheter in which the embryologist puts the embryo, we put it inside and we hope it's in the right place. And there's no way of checking. And this is one of the reasons why we now routinely do what are called ultrasound guided transfers, which means the patient has a full bladder and we do an abdominal scan, and with that scan we can see the uterine cavity, so that when we put the catheter inside the uterine cavity, we can see the catheter go in, we can position the tip of the catheter in the right place, and we can inject, and you can see a little white flash, which is not the embryo. The embryo is microscopic. You cannot see an embryo on an ultrasound scan, but the embryologist puts the embryo in air bubbles so that the embryo is tracked by the presence of the air bubbles, and air is echogenic. So it's easy to track it on the ultrasound screen. Now, one more thing you need to remember, a lot of doctors will give photographs of the ultrasound scan and tell the patient, okay, here's a photograph of your embryo. That is not a photograph of your embryo. That's a photograph of the ultrasound scan during the embryo transfer. These are two very different things. The ultrasound scan transfer photograph only tells us we put the embryo in the uterine cavity. It doesn't tell us anything about the embryo. The only person who can provide photographs of the embryo is the embryologist. And this is something every good embryologist does routinely.